Can I take this water? Do we have other waters?
Yeah, you can have it. Doctor, you want to just stand here? That's good.
Come stand right by us, doctor.
Yeah. Hi, Chris. Okay. Okay. All right, is everyone, you want to come back here? You're talking. Okay.
Let's wait for everybody to get in.
Okay.
All right. Good morning, everybody. And first, I want to thank Senator Klobuchar. She put this great event together, and she's been one of the greatest leaders, not only in the Senate, but in the country, on health care, on the extending the ACA tax credits, and in reducing costs for the American people. Now, tomorrow is a moment of truth for the Republicans here in the Senate. Are they going to bring health care costs down, or will they sit by and let premiums explode for millions of Americans? This vote is going to be one of the most important votes that they take in the whole term of the Senate, in the whole 2 years of the Senate. We have only 3 weeks away from massive and devastating cliff for millions of Americans. As you will hear from some of our guests here, this is not just sort of an on-paper, accounting, political thing. This is life and death for people. This is having a decent life or a life where you can hardly cope if you don't get the health care that you need. Congress should have solved this problem months ago. Hakeem Jeffries and I asked the Republican leadership and Donald Trump over and over and over again to sit down and come up with a solution to the crisis. They refused. We were ready. We said, let's negotiate. Let's find a path. Republicans refused to lift a finger. They knew the crisis was coming. But ever since the fight with Hillary Clinton on health care in 1993, the Republican Party has been just intransigent in not helping people, but just helping the special interests, whether it be the drug companies or the insurance companies or hedge funds or whatever else. They just sat there, did nothing. And now the day of reckoning is coming. And it's the day of reckoning for millions of Americans who are going to lose their health care, who are going to have to pay $500 or $1,000. A working family making, say, $60,000, they think they're in decent shape in most parts of the country. But how are they going to afford an additional $10,000 a year? What are they going to cut back on? Their health care, or their food, or their ability to buy some Christmas presents for their kids? So, with just days left on the clock, the clearest, cleanest, easiest, and best path left is the bill what Democrats are proposing. A clean extension of current tax credits. That's it. No poison pills, no gimmicks, just relief. Our bill is the only proposal on either side that has party-wide support on both sides of the Capitol. Democrats are fighting for lower health care costs for the American people. Republicans are fighting with each other. They can't even come up with a plan. So they put in this junk insurance thing, which I'm sure some of my colleagues will talk about, which does absolutely nothing. They're just so embarrassed they have no plan that they put in a really bad plan that is not going to get any support and is loaded with poison pills. What they want to do is send people a one-time check, maybe, if you're lucky, $80 a month. How on earth is $80 a month going to help the people here if their premiums are doubling and tripling because they don't do a thing? They don't change, they don't extend the tax credits by even a day, a minute, an hour. They just don't do it. They're so in the grips of the special interests and of their ideology, which says you're on your own, baby, that they are stuck. Our bill is the only bill that will prevent this crisis from happening. It's the last train out of the station. We urge our Republican colleagues, for the sake of the American people, to get on that train. So, we need 13 Republicans, 13. We ask Americans all over the country to call their Republican senators and say, this is your last chance. The vote is tomorrow. Last chance to help us avoid a crisis that will be devastating for so many of us. Bottom line is very simple. We should tell our Republican colleagues, every American should say, vote to protect your constituents. Don't let this crisis hit on your watch, because it is now your responsibility. And there are so many cases across the country. Every one of us, when we go back to our states, hears about these cases. And you will hear some of them now. And they really, I just talked to Becky Roberts, and it breaks your heart to hear what she has to say and what will happen to her if these credits are not extended. Becky.
Hi, I'm Becky Roberts. I'm from Virginia Beach, Virginia. Hi, sorry. I'm Becky Roberts. I'm from Virginia Beach, Virginia. I was born with a dislocated hip. They didn't catch it until I was 16. The deformities continued over time. I've always worked for small companies. I could have been on disability my entire life, but I chose to work, and I'm glad I did. But the companies I've worked for, places I've worked for, have been smaller and have never been able to offer insurance. In 2005, when my son was 5 years old, he's Asperger autistic. My husband was a cancer survivor, and I had the disability. At that point, if we could get insurance on the regular market, it would have been $5,000 a month. Needless to say, we didn't have a spare $5,000 a month. Years later, I got on the Affordable Care Act. I've been on the Affordable Care Act for a few years now. My husband has passed, but my son was able to get the treatment that he needed. Medical technology caught up. This summer, I had surgery to correct my hip deformity. I'm currently undergoing physical therapy. My premium has gone up 110%. Which I can probably manage, but some people can't. If I'm allowed to keep my insurance, if I'm allowed to continue with physical therapy, within a few months to a year, I'll be out of the wheelchair. Otherwise, this is where I'm going to be for the rest of my life. I want to do basic things like walk my dog, simple things like that. And if I'm allowed to, I can have those dreams, those simple dreams. My story is the story of millions of people that are being impacted by this, some that could lose cancer treatments and things even more serious than mine. But it's a matter of life, and it's a matter of quality of life. Thank you for being here today, and thank you to the senators.
Thank you. Thank you so much, Becky, for being willing to join us and share your story. And it just proves right there. Have health insurance, be able to get the care you need. She's going to be able to get out of that wheelchair. Otherwise, that's where she stays. So what this is about is just a clear line in the sand. Democrats are fighting for health care. We're fighting to reduce premiums, and specifically on the Affordable Care Act, where we well know that 75% of the people who are on these plans are in red states that Donald Trump won. And now while he is on his so-called affordability tour, in which he has chosen to call affordability a hoax last night, there are people like Becky and others you're going to hear from today who are struggling. Americans across the country are being forced to make choices right now. They're seeing that their premiums have doubled and tripled. They are weighing what this means for their families. Should they have no plan? Should they get a junk plan? Should they stay in a job when they actually want to go start a business? Should they have to close down their business? Maybe they have one employee, like one woman I met in Minnesota whose employee just got through cancer, is doing well. Do they have to drop that employee because of the doubling of the premiums? They have to start paying the new rate starting next week, Monday, December 15th. That's why we're doing this vote right now. Republicans can't kick this problem down the road to January. It's not a January problem. It's not a February problem. It's a now problem. So we have once again offered a straightforward solution. Obviously, there's many more things we would do to reform our healthcare system and make it more affordable. But right now, to stem this disaster and crisis that Donald Trump has created by refusing to do anything about extending the tax credits for the Affordable Care Act, we are saying right now we can do this. So what's going to happen if we don't? Well, you're going to now hear from Aaron an Iowa farmer from Polk County, Iowa, a place I visited a few times, a fifth-generation family farmer. 23% of farmers are on these plans. An extraordinary number of rural people are on these plans. And what you've seen in the last month, from elections from Virginia and New Jersey to Georgia and Colorado to Miami last night, where the first Democrat was elected mayor in 30 years, in the Georgia legislative race, which was off everyone's radars because no one thought it was winnable, the people of this country get it. It doesn't matter how many tours you go on that have the word affordability. When you call it a hoax and you actually don't do anything about it, the American people can read their bills. They can see their premium increases. So with that, I just tell our Republican friends, you can do it with us on this vote, and you can fix at least this current problem. You can do it with us by putting this on legislation, or we are going to march into the midterms against your resistance and win and get this done. And with that, I am so honored to turn this over to Aaron Lehman, who, as I noted, fifth-generation farmer, talk about the ACA and what it means to his family. Thank you very much.
Good morning. My name is Aaron Lehman, and I farm in northern Polk County, where I grow corn, soybeans, oats, and hay. My family and I are farmers because we love to grow things that feed our neighbors, our communities, and the rest of the world. But that is getting harder because, for my wife and I, our health care costs are about to double. The Affordable Care Act has been one of the best investments in rural health care in decades. For farming families, entrepreneurs, and employees at small businesses who don't offer health insurance, the ACA has expanded coverage, lowered costs, encouraged rural Iowans to take more risk in developing and expanding our farm operations. And in the Farmers Union, our members are telling us how important the ACA has been for their families and farming operations. For myself, my family having access to the marketplace insurance policies has been a must because the affordability provided by the enhanced premium tax credits make our budget doable. My wife is a breast cancer survivor. Without the Affordable Care Act, she likely wouldn't have even been offered an insurance product because of her pre-existing condition. Because of the Affordable Care Act, when she was laid off later because of downsizing, she was able to access affordable insurance and go back to school and get a higher degree. Now she's an independent contractor, providing care for elderly and other citizens in need, and she still has the access to that coverage even though she's an independent contractor. And it allows her to help out on the farm during our busy season because we know that we have coverage. And on our farm, the ACA has done other things to help us. It's made it more affordable for us to figure out how to replace and fix aging equipment, to bring new innovations onto the farm, to explore new markets for what we grow, and to take smart steps to bring the next generation onto the farm. All of this increased economic activity has been beneficial to our rural communities. But if the enhanced premium tax credits expire, the cost to farmers will be deep and it will cave in family budgets. Our rural hospitals and clinics are already struggling with Medicaid cuts and super tight margins and a very thin labor market. Without the ACA and being affordable, our hospitals and clinics will struggle even more. Extending the enhanced tax credits would benefit farmers in all of rural America. Our farmers are already facing low prices because of trade tension, increased input costs, and USDA programs and offices that are struggling to help farmers that they were made to help. An increase in health care costs is the last thing we need.
You're hard to compete with, Aaron. You said it really well. The first comments made yesterday by the Senate Majority Leader, John Thune, were once again talking about fraud and his claims about fraud. The Republican concern about this is basically they go out and kick workers, hardworking workers, off their health care, and they call it anti-fraud. We, on the other hand, have criminal penalties for real fraudsters, insurance brokers who fraudulently enroll people in coverage. And the fact is, that's the difference between the two political parties. One of them talks empty rhetoric, the other actually delivers on priorities like busting real fraudsters with criminal penalties. The insurance offerings in the Republican bill are snake oil. They will spark a new avalanche of junk insurance plans where insurance companies make out like bandits. The Republican plan's going to leave millions of people, in my view, racked with poverty. The reality is, if you have, for example, an appendectomy, your tonsils out, you're delivering a baby, you are going to be met with a wave of debt as a result of their payments being so small. We, on the other hand, have a small, simple solution, straightforward. We make it clear that people are going to get real relief, and they're going to get relief now. We're not looking for ideological trophies, as my colleagues have said. We're looking for real results that provide real relief. And that's why I'd like to introduce Krissa, who's here to share her story. And I think, like the other speakers, you're going to see these are the messages from people all over the country who are suffering now, who will suffer more if our legislation doesn't pass. It stands in sharp contrast to the empty promises we heard yesterday from Senator Thune. Krista.
Thank you, Senator Wyden. My name is Krissa Ostenso, and I'm from Ladysmith, a small rural town in northern Wisconsin. For more than 30 years, my husband and I ran the only optometry clinic in our community, actually in our whole county. We raised 4 children there and worked hard to keep our practice open. It was never easy. There's a lot to do when you've got a small business. And of course, one big problem was figuring out how we were going to afford health care for our family of 6 over the years. You do your absolute best to plan, but the truth is that you never know when life will change in an instant. This past year has been hard. My husband passed away unexpectedly last November, soon after I had to close our clinic. So I've spent the year grieving, trying to sell our practice, and figuring out how to live on a fixed income at a time when food, gas, electricity, and housing costs keep rising. Right now, I have a $1,300 a month from my Social Security, along with some planned retirement savings. Because of the tax credits, I can comfortably afford health insurance. But if Congress chooses to let those go, I will soon be paying $1,500 per month more than I currently am. That's obviously more than even my Social Security check is, and that'll be pretty hard to afford. The truth is that most of us are just one step away from losing our job, losing a loved one, having a major life change outside of our control. And in those moments, programs that help us meet our basic needs, like health care, are more important than ever. Yet instead of making things easier to access and afford, Republicans are using their full power in Congress to make our basic needs more expensive and further out of reach, all to give larger tax cuts to the rich. Our healthcare system is not perfect, but letting these credits expire will make things worse, more expensive, more out of reach, and more dangerous. I know I cannot afford this $1,500 increase, and I know my community can't either. With these premium hikes, some people will go uninsured, avoid care, and possibly die. These are not hypotheticals. We lived this before, and it was devastating. I'm here today because I worry not just about myself, but about my neighbors, the small business owners, the seniors, the families who are already stretched thin. These credits are a lifeline. They keep rural towns like mine afloat. Please do not let them expire. We need policies that make life more affordable, not less. We need leaders who protect their constituents, not burden them. Republicans in Congress, there are only a few days left. before we pay our first premiums for the new year. Please vote to extend these tax credits and protect families like mine. Thank you.
Well, to Becky and Aaron and Krista, thank you for coming here to speak truth to power, to tell your story, and to plead our Republican colleagues to do the right thing. You heard Krista's story. She is facing a $1,500 per month increase in her premiums. And Donald Trump is out there telling America that the cost increase crisis in this country is a hoax. In Connecticut, there are about 250,000 people who get their insurance through the Affordable Care Act. Nationally, about 22 million. In Connecticut, the average annual premium increase starting January 1st is over $6,000. And Donald Trump is saying that the cost increase crisis is a hoax. Donald Trump has no idea what is going on out in America today. He has no idea the misery that is about to be visited upon American families this January, because all he cares about is padding his own pockets and padding the pockets of his billionaire and corporate friends. Now, Republicans could just do the right thing this week. They could vote for a simple bill to just postpone this disaster. And instead, they have spent the last month either ignoring this crisis or arguing amongst themselves. They're apparently going to put a bill on the floor that is a joke. The Crapo-Cassidy bill is a joke. It doesn't reduce people's premiums by $1. It forces families to sign up for worse health care than they have today. And the question is why? And the answer is unfortunately simple. The only thing Republicans care about is protecting tax breaks for billionaires, millionaires, and corporations. And the way that they are paying for their tax breaks for their billionaire friends is to rob 22 million people of quality insurance. And they will do anything and everything, including driving up costs for millions of Americans, if that's what is necessary in order to protect the favors that they are giving to their rich and wealthy friends. We have 24 hours left, and we are here with these heroes, the American heroes, who are unfortunately just the tip of the iceberg, to ask our Republican friends to reconsider. This is a moment where they can choose to do the right thing. I'm really pleased to introduce someone who can highlight the sort of unimaginable scope of the catastrophe that's going to happen in January if Republicans don't do the right thing. Because yes, there will be millions of Americans who will lose their health care. There will be millions of Americans who will have unaffordable cost increases that will cause them to choose every day between buying food or paying their health bills. But there will be a broader crisis in our healthcare system, even for folks that have insurance, because all those folks who lose their coverage, they're going to show up in the emergency rooms. There are going to be a lot of clinics that won't be able to keep their doors open. And so to talk to you for a minute about what the impact on providers are going to be, I want to introduce to you a critical care physician focusing on pediatrics, Dr. Heidi Appel.
Hi, I'm Heidi Appel, a critical care pediatrician in DC. I live in Virginia. I want to thank these leaders for continuing to shine a hard light on a looming disaster that threatens the lives, health, and safety of millions of American families. As a doctor who has served my community for years and takes care of some of the sickest children, I see and hear firsthand how healthcare cuts hurt people. My patients, their families, and even some of my coworkers are growing worried and fearful about being able to afford their health care. For years, health care has been growing more expensive and harder to access. Families and communities across Virginia, D.C., and the whole nation are at risk of losing their health care. One of my patients, a teenage boy with insulin-dependent diabetes, rationed his insulin because his family couldn't afford the cost. He went into a diabetic coma and was found unresponsive. In the hospital, there was nothing we could do to reverse the damage caused by a lack of insulin. His brain herniated and he died. While I wish no parent would ever make the cry of anguish that I hear in the pediatric ICU, I do wish that policymakers had to hear the sound of a parent who has lost their child or watch me tell a parent that their child has died because they couldn't access the health care they deserve. Without the Affordable Care Act tax credits, families I see every day will face impossible choices. Do they keep their insurance or do they keep a roof over their heads? Do they buy the medicines their child needs or do they buy groceries for the week? No parent should ever have to make those choices, and yet that is exactly what will happen if these supports disappear. These kids don't have lobbyists. They don't have political power. What they have are parents who love them fiercely and doctors like me who will fight for them with everything we have. But no matter how hard I fight in the PICU, I can't fight policy decisions that strip away their access to care. These lawmakers must be held accountable. Thank you.
Good morning, everyone. We're on the eve of such a consequential vote that will define and determine the future of healthcare in this country, about the Affordable Care Act that has helped millions of Americans. This vote reminds me of a similar time 8 years ago. I was not in Congress at the time. I was a father of a newborn baby, a baby that had health issues right out of the gate. And I remember at that time being at the hospital and looking up at the TV screen, and on the screen I saw my own congressman at the time leading the charge on trying to gut the Affordable Care Act under Trump's first term. In fact, he was the author of the legislation that gutted pre-existing condition protections. And I'm a son of a polio survivor. I'm the father of a little boy that was struggling with his health at such a young age. And I couldn't believe that my own representative was leading this charge that would hurt my family and so many other families. So I decided to stand up and challenge him. I never ran for office before. This was a district my congressman had won by 20 points in his previous election. No one thought it was winnable. But we showed that health care is important to everybody, that it doesn't matter Democrats or Republicans, that it's about the care that we received. And I was proud to be able to stand up and hold him accountable and to be able to win that race and to be able to be here in Congress now 8 years later. I can't tell you how surreal it is to continue to go through this problem. I'm sick and tired of this. I'm sick and tired of leaders here trying everything that they can to be able to take health care away from people that need it the most. And I'm appreciative of what you shared, that doctor shared here about the concern that she has about not just those on the marketplace, but all of us. And I stand before you as not just as a father of now that 8-year-old child now who is doing so much better with his care, but I also stand before you as a son of a nearly 80-year-old father who I spoke on the floor yesterday about, talking about how he was just diagnosed with Alzheimer's and how devastating that is for me and my family, but for millions of Americans across this country. I am part of that sandwich generation that so many can attest to, the difficulties that we're trying to do to provide care for young kids as well as care for our aging parents. And as I hear from so many others, nobody wants to be able to be in a position where they have to worry about the care, but instead I have to worry about not just the care that I can provide my father, but the care that I can provide my father that I can afford. We're the richest, most powerful country in the world. No one should have to think about that. I was just in a hearing in the Health Committee, in the Healthcare Committee, going through these different proposals of the Republicans, and I asked every single one of the witnesses, including the witnesses brought by the Republicans, is it the fault of these people on the marketplace that their premiums are going up? Is it Becky's fault that their premiums are going up? Every single one of them said, of course not. And then I asked them, these plans that the Republicans are bringing forward right now, are any of them implementable in the next few weeks? Are any of them going to offset the cost increases that these families are going to experience? Every single witness said, no, it's not feasible to be able to have any of this implemented to offset the cost increase. So then I asked, why are we doing this? Why are the Republicans pushing this forward? Literally pulling the rug out from under these American families with no fault of their own. We are playing with other people's chips here. The Republicans are playing with other people's chips. They don't understand what people are going through. So I just wanted to join my colleagues here and join the others here to be able to say we can choose to be able to support Americans. Healthcare, this is about political will. It's a choice, and that choice will be before the U.S. Senate tomorrow. And we know what choice the Republicans are making, and we know that is the wrong choice for America. Thank you.
Okay. Questions on this topic, and I hope our friends that have come to make their cases here, Becky and Aaron and Chrissa and Dr. Apple, see the passion that our Democrats bring to this fight. Our true belief that if we could just get this extended, if they just voted yes, as Senator Murphy pointed out, within the next 24 hours, that we could make things better for a whole bunch of people, millions and millions of people. So that's a decision they're faced with. So questions on this of anyone up here? Yeah.
How big of an obstacle is the Hyde Amendment in terms of getting to a bipartisan solution on this at some point?
You know, the Republicans are going to have to decide, do they want to play politics with this when they know very well where the votes are when it comes to abortion care, where they know very well what the state of the law is right now on the Hyde Amendment, already applying to some of this. So I don't understand when you've had a number of Republicans in the House and the Senate say they get it, this is a disaster to have these premiums double and triple, why they want to mess around right now and put abortion politics into the middle of this, but they know that that's not going to work.
Senator Klobuchar, if I can just add, Andrew, they've never been serious about this. At one point, they wanted to put Hyde in the tax code, something nobody's ever considered. As Senator Klobuchar talked about, we're trying to lower people's premiums, not look for an ideological trophy.
Okay. Leah Groden with CQ Roll Call. Are Democrats prepared to go into another government shutdown on the next funding deadline if this bill doesn't get passed tomorrow?
You know, right now we're focused on, number one, getting this vote and waiting. We've been waiting. They said after the shutdown they would come to us with serious proposals. As pointed out by Senator Kim, these are not serious proposals that they put forward. And that's what we're focused on right now. And I will say we're also negotiating appropriations bills with Senator Murray's great leadership on the Senate Dem. So that's what's happening right now. And that's not what we're focused on. We want to save people's health care right now. We want to make sure that Becky is going to be able to continue her treatment so she can get out of that wheelchair.
Are you actively engaging with any of your colleagues across the aisle to see if they would support this?
The Senate is a small place. There's 100 people. Doors are open. Senator Schumer's door is open at any time. And I think we don't know of some secret plan that's going on here. They have put out this proposal that we do not think one bit helps all these people who are seeing these premium increases. And other than that, they have not come with us. We put out 3 years. You know, they want to negotiate the number of years. They want to negotiate something, but that is not what's happening right now. So we're asking them to vote with us on the only real proposal that's out there.
And I'll just say, I mean, this is such a simple proposal. I mean, this doesn't fix everything that's badly broken in our healthcare system. Of course, there are members of our caucus who want to do much more than this. We're offering a very simple proposal that would stop this catastrophe in its tracks on January 1st. And they are fighting amongst themselves, arguing over a set of policies that wouldn't fix the problem. So we're going to be united tomorrow. We're going to deliver 47 votes to stop these healthcare increases. We don't need 53 of them. We don't even need 30 of them. We just need 13 Republicans. That's it. We will deliver the bulk of the votes to stop this catastrophe. And it would be a pretty sad statement about where the Republican Party is today if there aren't just a dozen of them that are willing to stand up and do the right thing.
Especially when it's their state, that you're going to see the greatest number of policyholders. Biggest states of policyholders are Texas and Florida. So maybe those senators should start there looking at what they're doing. Okay, I think that's it. Thanks, everyone. Thank you.
Thank you very much.